So in this video, I'll be discussing about the chemical classification of anti-malarial drugs. There are several drugs available on the market for the treatment of malaria. Broadly, there are two ways of classifying anti-malarial drugs. One classification is based on the chemical nature or the chemical structure of those drugs. So chemical classification is one way of classifying anti-malarial drugs. Second way of classifying anti-malarial drugs is based on their clinical utility, which is called as a clinical classification, or maybe it can be called as the therapeutic classification. So focus here today is to discuss about the chemical classification of anti-malarial drugs. Many times students, they find it difficult to remember the classification and the categories of drugs based on their chemical classification. So I'll give some clues to understand and remember the chemical classification of anti-malarial drugs. So let me write the word malaria. Now you can see here the word malaria. A is repeated 3 times here, and that is the clue for remembering the classification of antimalarial drugs based on the chemical structure or the chemical classification. Let us begin and discuss the categories of drugs. First, I will note down all the categories of drugs, and then we will discuss the classification and the examples. So the first category is called as the 4-aminoquinolines. So here A has come here, 4-aminoquinolines. That is the first category of antimalarial drugs based on the chemical classification. The second category is 8-aminoquinolines. This is the second category again where the A has come here. The third category, I will take the clue from here, quinoline methanol. Third category is quinoline methanol, because I have taken a clue from here, quinoline, and I have added methanol in front of it. The fourth category is called as the artemisinin and derivatives. So here again A has come. This artemisinin and its derivatives, the other name for them is called as the sesquiterpene lactones. You can remember that with the A. So artemisinin derivatives. So out of the 4 categories, you have 3 categories where it has been starting with A. The fifth category is the folic acid antagonist, or you can say antagonist of the folic acid. So that's the fifth category. Again here, the A word you can remember for remembering the classification. So fifth category is antagonist, or the drug which inhibits the formation or synthesis of folic acid. Sixth category is amino alcohol. The other name for amino alcohol is called as the phenanthrene methanol. So again amino alcohol A. So you can remember again another A for remembering the anti-malarial drugs. The seventh category is, so we have another category which is starting with A, which is antibiotics. So antibiotics, again it starts with A. The next category is alkaloids. Again it's A. The ninth category is naphthaquinone. So only this category and this category is not starting with A. So we have the 4 aminoquinolones, 8 aminoquinolones, quinoline methanol, then we have the quinoline methanols, then we have the alkaloids, artemisinin derivatives, folic acid antagonist, amino alcohols, antibiotics, and naphthaquinones. So these are the 9 categories of antimalarial drugs. So remember A's. Now I'll give the examples of these drugs. So most commonly used drugs, one of the most commonly used drugs is chloroquine. One of the most commonly used antimalarial drug is chloroquine. So we have to remember chloroquine because it is one of the commonly used drug which is from the category of 4 aminoquinolines. The second example in this category is amodiaquine. So these are the examples for 4 aminoquinolines. The second category example here is primaquine. Then we have the buloquine and tefenaquine. So primaquine, again you have to remember because this is a drug which is commonly used for treatment of hypnozoids in Plasmodium vivax. So that's why primaquine becomes important to remember, and this belongs to the category of 8 aminoquinolines. Quinoline methanol, example is mefloquine. Artemisinin derivatives. There are so many examples of artemisinin derivatives, starting with artemisinin itself, artemisinin. Then we have RT ether, then RT mether, RT sunate. So these are the artemisinin and its derivatives. The other name is sesquiterpene lactones. Folic acid antagonist, or the drug which inhibit the formation of folic acid. The drugs include sulfadoxine, pyrimethamine, then proguanil. Some books have given proguanil under the category of bigonides, but again that's a drug which inhibits the synthesis of folic acid. Amino alcohol, lumefantrine. Lumefantrine is an example of amino alcohol. Antibiotics, we have the doxycycline, clindamycin, azithromycin. So these examples are from the category of antibiotics. Alkaloids, quinine and its derivative quinidine. So these are alkaloids. Naphthoquinone, example is atovaquone. Atovaquone is, just remember it is starting here with A. So again, although the category is naphthoquinones, the example is atovaquone and it is starting with A. So if you remember if you look at the classification of antimalarial drugs based on the chemical classification, again I will just repeat, remember the chemical classification with A's. 4 aminoquinolines. 4 aminoquinolines, example is chloroquine. 8 aminoquinolines, example is primaquine. Quinoline methanol, I have taken the Q from here, quinoline. So quinoline methanol, example is mefloquine. Another A, artemisinin and its derivatives, artemisinin, RT ether, artemether, artesunate. Folic acid antagonist, so A is taken from here. Drugs which inhibit the formation of folic acid, sulfadoxine, pyrimethamine, proguanil. Amino alcohols, which are also called as phenanthrene methanols, example is lumefantrine. Antibiotics, doxycycline, clindamycin, azithromycin. Alkaloids, quinine, quinidine, and naphthaquinone, example is atovaquone. So this is the classification of antimalarial drugs based on the chemical structure or the chemical classification. Thank you.